CNA range of motion exercises. Welcome to the quiz. Question 1. You are assigned to care for Mr. Edward Murphy, a 65-year-old male patient who is recovering from major abdominal surgery and is on bed rest. He has expressed to you that he is anxious about using the bedpan or commode because he is concerned about his privacy and feels embarrassed about his bodily functions. He has asked you to help him, but he is clearly distressed about the process. You understand that maintaining patient dignity and privacy during elimination care is essential for promoting comfort and maintaining the therapeutic relationship. When assisting a patient with toileting and helping ensure both their privacy and their dignity, which approach represents the most appropriate and respectful method? Option A. Leave the bathroom or curtained area completely open with the door wide open while the patient is using the bedpan or commode, so that you can observe him and ensure nothing goes wrong, even though this may compromise his privacy and dignity. Option B. Close the door and draw the privacy curtain around the patient's area. Step outside the immediate area unless the patient specifically requests assistance. Remain nearby to respond quickly if the patient calls for help, and return promptly when the patient indicates he is finished. Option C. Position yourself directly facing the patient while he is using the bedpan so that you can monitor him closely throughout the process, reassuring him that your presence will help him feel safer and more secure. Option D. Ask a family member to remain in the room during the patient's use of the bedpan or commode, explaining that this will help the patient feel less alone and anxious about the process, and this maintains dignity by having someone the patient trusts present. The answer is B. Respecting privacy during toileting is essential. Option B is correct. Closing the door/curtain and stepping out unless needed preserves dignity while ensuring safety. Option A is wrong. Leaving the area open violates privacy. Option C is wrong. Staring at the patient during elimination increases embarrassment and is not necessary. Option D is wrong. While a family member may be comforting, the patient might still feel embarrassed. The best practice is to give privacy and allow the patient to call when ready. Question 2. You are reviewing laboratory results and vital signs for the patients you are caring for today. You are performing vital sign assessments on several patients and need to evaluate the findings to determine which results fall within normal ranges and which might indicate a problem that should be reported to the nursing staff. When reviewing a patient's vital sign assessment results, you obtain the following findings: blood pressure of 125/80 millimeters of mercury, mmHg, heart rate of 70 beats per minute, respiration rate of 16 breaths per minute, and a temperature of 101.5 degrees Fahrenheit, 38.6 degrees Celsius. Based on current knowledge of normal vital sign ranges and what constitutes an abnormal finding that requires immediate attention and reporting, which of these vital signs should be reported to the nurse immediately? Option A. The blood pressure of 125/80 mmHg is elevated and should be reported immediately, as this indicates the patient may be developing hypertension. Option B. The temperature of 101.5 degree F, 38.6 degree C, should be reported immediately, as this indicates fever, which can indicate infection or other serious medical conditions that require evaluation and treatment. Option C. The heart rate of 70 beats per minute is slow and should be reported immediately, as tachycardia might develop at any moment and needs to be prevented. Option D. The respiration rate of 16 breaths per minute is normal and all vital signs appear normal, so no reporting is necessary and the patient is stable. The answer is B. A temperature of 101.5 degree F is above normal, 98.6 degree F, and indicates fever, which must be reported so the nurse can assess for infection. Option B is correct. Option A is incorrect. 125/80 is slightly elevated, but not critical hypertension. It does not need immediate reporting unless it's a trend or symptomatic. Option C is incorrect. A heart rate of 70 is normal. Option D is incorrect because the temperature is abnormal. Reporting is necessary. Question 3. You are providing personal care and hygiene assistance to Mrs. Dorothy Williams, an 80-year-old female patient who is hospitalized for acute illness and requires complete assistance with activities of daily living including bathing, grooming, toileting, and dressing. You know that providing bed bath care is not merely a routine task, but rather an important opportunity for comprehensive patient assessment, skin examination, and promotion of comfort, cleanliness, and psychological well-being. In considering the purpose and goals of providing a complete bed bath for a patient who is unable to shower or bathe independently, which statement most accurately describes the primary purposes of this care activity? Option A. The main purpose of a bed bath is to rapidly decrease the patient's body temperature and reduce fever if the patient has an elevated temperature, as the water will cool the body and help bring temperature back to normal. Option B. The primary purposes of bed bath care are to maintain the patient's personal cleanliness, promote comfort and relaxation, provide an opportunity to assess the patient's skin for any changes or problems, and support the patient's dignity and sense of well-being during a vulnerable activity. Option C. The main purpose of a bed bath is to entertain and occupy the patient during the day so that they will not become bored while hospitalized, and to provide them with an activity to pass the time. Option D. The primary purpose of a bed bath is to prepare the patient for discharge from the hospital, as cleanliness is necessary before going home, and bathing should only be done immediately prior to planned discharge. The answer is B. Bed baths are performed for hygiene, comfort, skin assessment, and dignity, not for fever reduction, which requires medical assessment or entertainment. Option B accurately describes these goals. Option A is incorrect. A bed bath is not a treatment for fever. Water temperature is chosen for comfort, not to cool the patient. Option C trivializes the care. Option D is incorrect. Bed baths are provided regularly, not just before discharge. Question 4. During your shift, you are assigned to care for Mr. Paul Richardson, a 78-year-old male patient who has been hospitalized for 2 days and is showing signs of confusion and disorientation. He does not seem to recognize family members, is uncertain about what day and time it is, and appears to be having difficulty understanding explanations about where he is and why he is in the hospital. He asks you repeatedly who you are, why he is in bed, and whether his home is nearby. He becomes frustrated when asked to follow simple instructions and seems frightened by his surroundings. You understand that confused or disoriented patients require special communication approaches and support. Based on best practices for communicating with confused or disoriented patients and supporting their emotional needs, which approach is most appropriate? Option A. Speak very loudly and slowly to the patient using simple sentences. Repeat the same information multiple times in a row until the patient seems to understand, and frequently correct the patient when he makes false statements about his situation. Option B. Use simple, calm language. Maintain a calm and reassuring tone of voice. Identify yourself by name and title each time you interact with the patient. Reorient him to place and time briefly. Maintain frequent contact to reduce his fear and anxiety. Option C. Avoid communicating with the patient as much as possible to prevent his agitation. Limit your interaction to only essential care tasks, and do not attempt to explain things to him since he will not remember anyway. Option D. Tell the patient repeatedly that confusion is normal and that he will eventually remember everything. Use complex medical terminology to explain his condition and the hospital procedures, and encourage him to focus on other things to distract from his confusion. The answer is B. For confused patients, calm, simple, reassuring communication with frequent reorientation is key. Option B is correct. Option A is wrong. Speaking loudly and repeating the same information multiple times can be perceived as yelling and may increase agitation. Correcting false statements often frustrates the patient. Option C is wrong. Avoiding communication can increase the patient's fear and sense of isolation. Option D is wrong. Using complex terminology confuses them further, and false reassurances, you will eventually remember, are not helpful. Question 5. You are attending a unit meeting where the nurse manager is reviewing fall prevention strategies and discussing which patient populations are at highest risk for falls in the hospital setting. The manager is asking the nursing assistants to identify which patients require extra attention and special fall prevention measures. Based on your knowledge of fall risk factors and understanding of the patient populations most vulnerable to falls in healthcare settings, which group of patients is at the highest risk for falls? Option A. Young, healthy patients who are hospitalized for minor surgical procedures and are able to ambulate independently without any assistance or mobility limitations. Option B. Elderly patients, patients who are taking medications that affect balance or mental status, patients with history of falls, patients with visual or hearing impairments, and patients with conditions affecting strength or coordination. Option C. Patients who ask for assistance frequently and use call lights often, as these patients are seeking attention and are probably not at true risk despite their repeated requests. Option D. Patients who have many family members and friends visiting throughout the day, as the presence of loved ones prevents falls by providing both physical and emotional support. The answer is B. Elderly. Patients on certain medications, those with prior falls, sensory deficits, and mobility issues are at highest fall risk. Option B correctly identifies this group. Option A is low risk. Option C is wrong. Patients who ask for help are actually being proactive and are often at risk. Option D is wrong. Family presence does not automatically prevent falls. The patient may still be at risk. Question 6. You're working in a cardiac unit and are assigned to care for Mr. Thomas Fletcher, a 72-year-old male patient who is recovering from a heart attack that occurred 3 days ago. During your morning care rounds, while assisting him with hygiene and personal care, the patient suddenly clutches his chest, appears anxious and pale, begins sweating profusely, and reports experiencing severe substernal chest pain that is radiating down his left arm and into his shoulder. He is experiencing shortness of breath and describes feeling like there is pressure in his chest. The patient is clearly in distress and is frightened about what is happening. Given this acute presentation of chest pain and potential cardiac emergency, what action should you take first? Option A. Immediately give the patient water to drink and have him sit in a comfortable chair to rest while you complete your bathing tasks so that the patient is clean and comfortable before reporting anything to anyone. Option B. Stop all care activities immediately. Reassure the patient to keep him calm. Do not leave him alone. Use your call bell or another method to notify the nurse immediately that the patient is experiencing chest pain and possible cardiac symptoms that need urgent assessment. Option C. Have the patient lie flat in bed immediately to improve blood flow to his heart. Encourage him to practice deep breathing exercises and wait for approximately 10 minutes to see if the pain subsides before deciding whether to notify the nurse. Option D. Ask the patient to stand up and walk around the unit to improve his circulation. Explain that chest pain is common after heart attacks and will eventually resolve on its own, and suggest that rest will help more than reporting the symptom. The answer is B. The patient is showing signs of another cardiac event. The CNA's first action is to stop care, stay with the patient, and immediately call for the nurse. Option B is correct. Option A is dangerous. Giving water could be aspiration risk, and continuing care instead of reporting wastes critical time. Option C is wrong. Lying flat may not help, and waiting 10 minutes is life-threatening delay. Option D is extremely dangerous. Physical activity during a suspected heart attack can worsen the condition, and dismissing the symptom is negligent. Great job! Don't forget to subscribe. Bye.